I'm Rebecca Marmore. I'm a Johns Hopkins vascular surgeon. I practice out of Howard County General Hospital. Similar to coronary artery disease or peripheral arterial disease, carotid artery stenosis is the hardening of the arteries feeding the brain. Risk factors for carotid artery disease are similar to those for CAD and PAD. Patients who have a history of smoking are older. Typically, male patients are at higher risk. Patients who have end-stage renal disease or are on dialysis, patients with diabetes. These are all well-established risk factors for carotid artery stenosis. So most commonly, carotid artery stenosis is diagnosed off of an ultrasound study. What precipitates the ordering of the ultrasound can vary wildly. Sometimes an astute primary care doctor will hear what's called a bruit or an abnormal sound at a patient's neck and order an ultrasound. Sometimes patients will have already had a stroke or a TIA, be admitted to the hospital, and get an ultrasound showing they have narrowing of their carotid artery. Carotid artery disease increases a patient's risk of stroke or something called a TIA, also known as a mini stroke. Carotid artery disease is managed based on the severity of the patient's disease and whether or not the patient is having symptoms. We typically classify carotid artery disease into mild, moderate, and severe disease. The decision to have surgery for carotid artery disease is a very complicated one and is best made by an experienced vascular surgeon.